Okay, so wanted to talk about the survey for citizens to look at regarding the COVID-19 response, kind of the post COVID-19, and then let's see, and then the video you had posted yesterday about kind of those initial steps of reopening. So I'll start with the survey. What does the city or your administration hope or plan to do with the results from that data?
I think it's really good, Amanda, to be engaged with our community, especially about how they're feeling with the COVID response, the way that we've responded so far, and then how they're feeling now, several weeks into our Stay Home, Stay Healthy order. So we're going to have that survey available for the next several days. We've got 1,600 responses in the first day. So that's a really good assessment of how people are feeling, and we'll give those, put those results out after we get them.
Okay. So using the results to gauge how the community is feeling, but is there any action planned as a response to?
Well, I think that's part of the discussion about what reopening our economy looks like regionally. We are meeting now as a region with the county and with the mayors in the county on what our plan would be to reopen the economy. We're having discussions right now, as a matter of fact, about what that looks like. Eastern Washington, Spokane County certainly is drastically different than Western Washington. And we have been quite successful, I think, with our COVID response so far. Our numbers are down. In fact, our increases daily are in the single digits. Our healthcare system is not overburdened. We have capacity in our isolation facility and even extra beds in an alternative care facility if we need it. So I think the community has made it quite clear. I hear every single day at the mayor's office, small businesses that want to be able to reopen. People who have been out of work now for 6 weeks, they have lost 3 paychecks and they want to get back to work. So we are going to have a very comprehensive conversation about what that looks like. We do know that any plan that we develop needs to have universal criteria, that the rollout needs to be methodical, it needs to be orderly, and it needs to be flexible. So we don't just open all the businesses at once. We don't just flip that switch. We do it in increments and in phases. And we have to have the flexibility that if we do see a spike in cases, that we can hit the pause button, or we can even roll back some of the things that we're doing. And so those are the kind of conversations that we're having right now.
Sounds good. Looking over some of the survey questions, if there is an overwhelming response, one of the questions asking about the next step, what does the community hope the next step might be? If there's an overwhelming response to gradually reopen the economy now, how soon would we see the city take action on that?
We haven't decided that yet, Amanda. We are going to wait and see what the governor is going to announce. We expect that it will likely be an extension of the Stay Home, Stay Healthy order. But we feel like we are in a position where we can start opening things up. But that still plan is being devised. We will not do that until we have something very definite, a plan that is very definite that we can carry out.
So would the city reopen even if the governor says otherwise?
Well, that's a consideration. We'll look at that.
Okay. So would that also require, would the city even open with or without approval from the governor or Dr. Lutz?
Well, we want to get the county health officer on board too. This is a health crisis as well as an economic emergency. So we definitely want to get guidance from our health department, and we want their cooperation. They have to be part of the discussion as well. I mean, we want to make sure that when we do start opening businesses again, that we are exercising social distancing, that we are keeping people healthy. So that Dr. Lutz definitely needs to be part of the conversation.
So Dr. Lutz recently said in one of his press conferences, quote, "We are not at a point yet where we can back off and where we can really reopen." Do you agree with that?
Can you repeat that? You broke up, Amanda.
Dr. Lutz had said, "We are not at a point yet where we can back off or where we can really reopen." Do you agree with his statement?
Not today. We're not ready to reopen today.
Oh no, sorry, you're cutting out. Are you there?
Oh,
are you there?
Yeah. Can you hear me? Hello?
There you are. Okay, sorry.
Okay. Yeah. No, I would say, you know, I would agree with Dr. Lutz. We're not ready to open today. And we're not talking about opening today. We're talking about what a reopening plan would look like. And we don't have a timetable on it yet. But one of the things that we're very cognizant about is we want to maintain the gain. And we want to make sure that those COVID cases don't spike, that our increases are single-digit increases in cases, as we've seen in the last week or so. So that's very, very important to whatever we intend to do.
I know we're saying we need Dr. Lutz on board, but if we get to a point where the community says, yes, we're ready, the digits of the number of cases get down to the single digits, and Dr. Lutz does not get on board, is that a situation where we'd see city of Spokane moving forward with implementing its plan to reopen?
We want to get Dr. Lutz on board, definitely. So I think that's going to be extremely important. We're ready to talk about anything other than that, but we want this is a collaborative plan, and that includes the electeds in the county and in all the cities in the county and our health district. So this is something that we are going to work on together, and then we'll let the public know, we'll let the community know when we're ready to roll that out.
I noticed in the video kind of a reference to some fly fishing, as far as those activities that you mentioned are already a physically distanced activity. You can kind of explain what those might entail. I know maybe it's too early to ask that, but I know a lot of folks that want to get outdoors might get excited to see, oh, well, maybe this is an activity I could see.
Well, as the weather gets nice too.
Yeah, right.
You know, I don't know about you, but this last weekend I saw a lot more people outside. I saw most of them were social distancing, so that's good. But there are some outdoor activities that just naturally allow people to social distance. Golfing is one of them. I know people want to get to fishing. Fishing isn't just a sport in our region. People feed themselves through fishing. So, you know, food security is definitely a priority as we respond to our COVID emergency. So those are all things, but those are all things that we're going to be talking about, Amanda, and we'll let you know. But yeah, there are outdoor things that we can do that allows for social distancing. And, you know, let's talk about allowing people to get back to some of those activities.
After the governor's announcement today, we're kind of expecting an extension potentially on the stay-at-home order. Does your office plan on having conversations in the near future to kind of coordinate the city's approach to reopening? Absolutely.
We're in constant conversation with not just the governor's office, but with his Eastern Washington representatives as well. I'm on a call every Friday with the mayors of the 5 biggest cities in the state of Washington, Seattle, Everett, Tacoma, Vancouver, and Spokane. And we're all talking about what a regional approach would look like in our own areas as well. So that conversation is continuing every week.
Sounds good. Is there anything else you'd like to add about this? And it's in the discussion. I know you made that very clear in the video. This is very preliminary. Yes. Conversations are still ongoing. I'm not sure if there's anything else you'd like to add to that.
I would, Amanda. I would just ask people to just please be patient. I know that there is some frustration out there. I know there's an eagerness to get life back to normal, but what does that new normal even look like? We don't even know yet. I think it's going to be the new abnormal. But if people could just continue to exercise good hygiene, social distancing, and patience, because we've been doing a really good job so far. Whatever we do to reopen our economy, again, in those small phases, we don't want to compromise the ground that we've already made so far in our COVID response.
And I think it's important, great that you highlight the importance of having flexibility in the plan moving forward. Like you said, if we do start to see that surge, being able to dial it back or tighten those restrictions for just a moment and see where it goes.
Absolutely. We have to be flexible. So thank you.
Well, thanks so much. I appreciate it. We'll have us on at 6 o'clock tonight, but appreciate you making the time.
Okay, you bet.
Great. Take care.